Good morning, everybody, and we welcome you. We're in the KLHS studio here at Liberty High School this month. My name is Dallas Ackerman, Director of Communications and Marketing in Liberty Public Schools, and want to thank everyone here at the KLHS program, Liberty High, for having us, as today we had some conflicts at our District Administration Center, so we weren't able to host this virtual event there, but everyone's so accommodating here to allow us to come in for this very important topic here today. Before we get started, I just want to give a quick reminder. It's hard to believe, but just one more Coffee with the Community held virtually this semester, as you can see on your screen. We're slated to return on Thursday, December 15th, as we'll have a long-range facility master planning update to close us out this semester. And then we've planned ahead for second semester. You can see some of our other topics as we roll into 2023. And we'll close out the series on Thursday, March the 30th, and we will announce that topic here very soon. So, glad you could join us. It looked like we had an audience built here early on, and all of these topics are extremely important every month, but we really feel the urgency and the need to talk about what we're going to talk about here in the next few minutes. And we have our Director of Health Services, Kathy Ellermier. She is here. She's going to introduce our guests here that have been so kind to join us from Clay County. And then as this presentation's taking place, I just want to remind anyone watching out there live with us that you can submit your questions to us in the comments section on our Facebook page. We'll obviously also make this available in archived format. So with that, Kathy, I'm going to have you step in and take things over.
Thank you, Dallas, and thank you all for tuning in today. We would like to address a really important and heartbreaking topic today on our fentanyl crisis that's not only taking over kind of communities all over the United States. And we are really thankful for our strong partnerships in Clay County and in Liberty, and our community partnerships are just vital to our success and the success of our students to thrive and be lifelong learners. And so we're thankful to have our community, one of our strong community partners today, and that would be from the Sheriff's Department, Sheriff's Office. A big shout out to Sheriff Will Aiken and his whole team in linking arms with us and just in the fight that they're in, and they're in the trenches every day with this sad situation. And so I'd like to introduce part of the Clay County Drug Task Force, and I'd like to introduce Sergeant Farmeyer and Investigator Wilson, who's here to share some firsthand information and some really great sobering things with us. So buckle your seatbelts and let's tune in here. Thank you, guys.
Hi, welcome. Thank you for having us here. This is a very important topic to us. It means a lot to us. We've been investigating opioid overdose deaths here in Clay County now for the last couple of years. Since COVID, they really have kind of taken off. A lot of them have been kids in high schools, and so this is something new we've been doing by going out and trying to get the information out there first, and getting to kids first and getting to adults first to talk to them about the dangers of fentanyl, the other dangers of other narcotics that we're seeing on the streets, and try to take a different approach to fighting the war on drugs, and that's getting to the people before they get addicted, and try to interdict some of this. So again, I'm Sergeant Jeremy Farmeyer. I'm of the Clay County Sheriff's Office Drug Task Force, and this is Detective Wilson. Just a little bit about presentation here of what we do and information about fentanyl. So just a few facts about fentanyl. Fentanyl is a synthetic opioid that falls in the same category as with morphine and heroin. It is 50 times more powerful than heroin, and it's 100 times more powerful than morphine, to put it in perspective. You can see on this slide there what it comes in a couple different forms. Mostly it comes in a powder form. that you see there just looks like white powder. That's the most dangerous kind of fentanyl that in that form, because it can be airborne. You can get it in through your skin, and you can have an exposure that way as well. It also comes in the pill form, which we'll be talking about here in just a minute. Here's some more facts about fentanyl. 42% of the pills that we seize and that we send to the lab contain a potential lethal dose of fentanyl. It only takes 2 milligrams of fentanyl for it to be a lethal dose, and that is not very much. I've got a slide coming up that will demonstrate to you how little it takes for someone to overdose on fentanyl. Drug traffickers, they typically distribute this by the kilogram, which is a little over 2 pounds. Little over 1 kilogram of fentanyl can kill up to 500,000 people, which basically is like the greater KC city limits population. I think the population of KC is like 450,000. Just put that in perspective. Right now, fentanyl is a primary killer of young adults from the ages of 18 to 25, and that supersedes, combined with car accidents, suicides, illnesses, you name it. That all put together doesn't come up to the amount of people who are dying from overdose from fentanyl. This is also, we've been doing investigations of kids as young as 14 that have overdosed and overdosed and died from this. So this is something that's even hitting our young people, and we've also done investigations with this involving people even into their 50s. So it does not discriminate as far as age-wise. Fentanyl is responsible for at least 70% of all drug deaths. That in 2020 was a little over 37,000, and in 2021 that number jumped to 41,000. That's an increase of 12%. That's a lot about that time frame when we really started coming across this. It really hit our radar in early 2020. We started investigating a girl who had overdosed from another state that had come to Clay County to purchase a fentanyl pill, and she did not know what she was getting at the time. And 2 girls, they took the pill. One girl was she was okay, and the other girl had overdosed and died from it within the matter of half an hour. So that's what kicked this all off for us and brought this to our attention, that case. There is, right there is a couple of examples of what 2 milligrams of fentanyl looks like. That right there on the tip of the pencil, that is about 6 to 8 grains of table salt is about to compare it to. We're also investigating other strains of fentanyl. There are other kinds out there that they make in the lab, and they just change the chemistry of it. And by doing that, they can not only change the name of it, but they change the potency of it as well. For instance, one of them that they are now creating in the lab, and it's here in Clay County, is carfentanil, which is so powerful that the amount you see there on the tip of the pencil, basically if you cut that in half, that would be a lethal dose of carfentanil, which comes down to about 3 to 4 grains of table salt. That's how powerful it is. It's 100 times more powerful than regular fentanyl. Where does it come from? Good question. It comes from, primarily most fentanyl comes from Mexico. It comes up here to Kansas City via either the mail, smuggled in trucks. It's brought by person in cars. Just about you name it. They find some pretty ingenious ways to get it up here. Most of it is made by Mexican cartels in Mexico, and they in turn primarily get their chemicals to make it from China. They buy it off the dark web, just like people here in the States. They can buy it off the dark web as well and get it shipped right to their house. But primarily most of the fentanyl, along with the meth, comes from the Mexican drug cartels, and it's shipped across the border through various means. Here's some stats. So myself and Detective Wilson, we're part of a MOWIN task force. Excuse me. What that makes up is multiple agencies in the greater KC area. We work with not only Clay, but it's Platte County, Jackson, Missouri Highway Patrol, KCPD, the FBI, DEA, HSI, all the organizations, we all work together to try to interdict this and other narcotics coming into KC. Last year, we intercepted in a little over 68,000 grams of fentanyl. That works out to about 72 pounds. So you remember in the previous slide where I said a kilo could potentially kill up to 500,000 people. Well, just in last year, we brought in 72 pounds of it. So that tells you the sheer amount of fentanyl that's being passed through Kansas City, and excuse me, and that's being sent on to other locations in the United States. Okay, so we're going to talk a little bit about the pills now that are laced with fentanyl and how realistic they are. So these here on the left you see are the blue M30s, they call them, and they have M on one side and they'll have 30 on the other, and they're actually a real prescription of Percocets. Primarily these fake Percocet pills are made up of acetaminophen, which is your basic Tylenol, with some fentanyl mixed in with it as well. And there on the right is a Xanax bar. We're also seeing how these are being made counterfeit as well. They're made up of the same ingredients, primarily acetaminophen, with some fentanyl mixed in it as well. These pills are made to look just like the real things. They are very hard to tell to the untrained eye of whether they are real or fake. And they are getting very good at making these. Here's some more examples of it. You'll see in that slide on the left, those one pills there are real, and the others next to it are fake. Typically, the coloring, we can tell the coloring might be off on them, or they may not hold together as well. They might be a little crumbly. That's some telltale signs that they're not real. Sometimes they get them too blue, or sometimes they come out a little green. But for the most part, it's really hard to tell them apart, and they're not very big. Here is some example of powder fentanyl, and as you can see, it looks a lot like cocaine. It also looks a lot like meth, so it's hard to tell the difference. A lot of the narcotics that we're seeing on the streets of Kansas City right now, almost all of them are going to be laced in some way or another. They're going to be laced with fentanyl. We have cases where people are overdosing on heroin that's being laced with fentanyl. We're also investigating cases where people have overdosed on meth that's laced with fentanyl, cocaine, and even now that's being seen is, we've seen it here, is your basic marijuana that you're buying off the street is now being laced with fentanyl as well. Here's another example, just some of what we're seeing out there, the gummies you have that can be laced with it, the marijuana. Up there in the upper right corner, you'll see the multicolored ones. That's the rainbow fentanyl that made the news before Halloween that everyone was talking about. Those are in the KC Metro as well. I know that they've been purchased in Jackson County. They are exactly the same thing as what the blue M30s are. They're just changed the colors of them. And why, you may ask, is that they would change the colors of them? Well, these drug traffickers in Mexico, I mean, they're smart. They are marketing to a specific group of people. So what better way to make these look safe and fun and kids can have fun with them than to change the colors and make a multicolor of different fentanyl pills. So that is what they're doing now. How is fentanyl being made? So right here is an example of a lab where medical fentanyl is made. It has uses in the medical field, great uses in the medical field. It's used in epidurals. It's also used in patches for cancer patients. And you can see here where it's in a sterile lab. And everything is sterile, everything is pristine. The person has the hazmat suit on, and it's in a controlled environment. That's the medical fentanyl. This is how illicit fentanyl is made. This is an actual lab that was done by the DEA in the jungles of Mexico. The illicit fentanyl that's being sold in the United States, this is how it's being made. You can see the guy standing there protecting it with his AR-15. You have the other drums with the chemicals in it. It's not pristine by far. and just gives you a sense of how it's made there. This is an example of another lab where illicit fentanyl is made with the containers and with the other chemicals as well. This here is a pill press. The one on the left is a single pill press. It's just made one pill at a time. The mechanical pill press you see there on the right, that can produce up to 6,000 pills an hour. And basically, how they make those into those pills like that is, again, they'll take basically your primary ingredient of the acetaminophen, put it in a vat. They'll mix in the fentanyl with it. It's not a measured amount. These aren't made by scientists. So when this is all mixed up and put out in pill form, the problem that we're seeing is you don't know where in the pill the fentanyl is at. It could be all grouped into one little section. It could be all spread out. We like to equate it to a chocolate chip cookie. Sometimes you got all the chocolate chips on one side, sometimes you don't. And the problem is you just don't know where it's located in the pill. We've done cases where people have overdosed off of fentanyl pill that had only used little as a quarter of the pill and had overdosed from it. Something we like to remind the kids when we talk in the school classes with them, which we do. Just a few weeks ago, I was in Liberty High School talking to the 9th grade health class all day, and something we like to reiterate to them, if it comes from your parents, it comes from a doctor or a pharmacy, that's real. I mean, you're getting real prescription medication there. What we are trying to stress is pills or medication that you get from friends or a stranger. If you're ever in doubt if you're given something to take, whether you have a headache, whether you think it's ibuprofen, it doesn't matter what it is. If you have any kind of doubt about it, contact your doctor, contact your parents, and check with them first before you take anything. Your school nurse. That's something that we strongly try to reiterate. Right here is just some paraphernalia that we see in the drug trade from fentanyl or methamphetamine and heroin. On the left, you have your syringes and your spoons, and on your right is your typical foil. That is very common in fentanyl pill use. You can see the black marks on there. That's used from where the pill is being burnt and it's being inhaled through a straw or other means. And that is one of the most common ways that the fentanyl pills are being used. Here is some more paraphernalia, different examples of drug paraphernalia that we see from fentanyl pill use. We have, again, the foils, the syringes, the meth pipe there, straws, and something I'm getting ready to be talking about. You'll see in the right-hand corner a couple of things of used Narcan. Signs of an opioid overdose. So, and when opioids get up into your brain, your brain has receptors in it, pain receptors, and your brain will send off dopamine to those pain receptors to ease your pain that you might be feeling wherever that is at in your body. Well, there's also the opioid medication that that's given to you that goes into your brain, and it sends off those dopamines more to the receptors to ease your pain. Well, what can happen is you get too much of that opioid up there into your brain, and it overloads the receptors. So when that starts happening, your brain kind of starts spiraling downward, because what an opioid does is, along with morphine and heroin and things of that nature, it will lower your breathing rate, and when it starts lowering your breathing rate, then it will start lowering your blood pressure. And then once those two things starts happening, basically your body starts spiraling downward, and you basically go to sleep, and you don't wake back up. That's an opioid overdose. It's typical of people who are in an overdose. They look like they're asleep. They might be snoring or breathing real deeply. They're hard to wake up. Their lips could be blue. Their skin color could be blue or gray. So if you find someone in that kind of a situation, call 911 immediately, and then do everything you can to try to wake them up. If you have Narcan, administer Narcan. I'll explain that here in just a second. Just a stat of what it is here in Missouri. In 2020, it was a 19% increase of opioid overdoses from 2019. We seized more than 9.6 million counterfeit pills by the end of September 2021, and that was greater than the last 2 years combined. So again, since 2020, this has really taken off, and it has not slowed down since then. Here's Narcan. So what is Narcan? Narcan is a safe medication that is given to someone who's in an opioid overdose. It's distributed by placing the nozzle up the person's nose and squeezing the bottom of it. It will interject the medication up to the person's brain. And basically what it does is, for lack of better terms, it creates a brick wall in your brain that stops your pain receptors in your brain from receiving that dopamine from the overload from the opioids. So it brings that person out of a overdose. Now, it may take 1 or 2 doses to make that happen, but it will bring them out of that overdose state. But once they're out of that overdose state, still call 911, because they can easily go back into being in an overdose state if they don't get more medication. So here's a slide of how it's administered. Laying them on their back, leaning their head back, and putting the nozzle up the nostril, and interjecting it with a push of the at the bottom with your thumb, and that will interject it straight up to the person's brain. We like to stress how important Narcan is. It's a two-edged sword. Some people argue that, well, are you just encouraging people to use this and just saying, well, Narcan will save you? But that may be the case, but it's better to be on the safe side. We try to reiterate how important Narcan is to have on hand. We keep it on us all the time. We keep it in our cars. We are now working with multiple school districts in the greater KC of having this available to the nursing staff in their schools. I know Liberty is working on that now, or already has that accomplished. Kearney is doing the same thing. And we're also working right now to get this with our medical staff in our jail facility in case of a mass fentanyl exposure, that it's there readily available for the inmates and staff. So I like to talk to the students about how they are being targeted. One of the biggest ways they're being targeted is through Snapchat. They like to advertise what they have for sale for their illegal narcotics right on their stories on Snapchat. So be wary of what you're getting from strangers on your social media. And if you see something suspicious, report it to your parents, report it to school staff, or anyone, or even law enforcement. This is just some information on some slang words. We all know that with high schoolers, it's changes every day. I have to keep up with my kids all the time of what's the latest words that's going around for different meaning different things. So this website here is a good way to keep up on that, and it's very useful. So another thing I like to reiterate to the kids, I was a teenager once. I remember what it was like. You think you're indestructible, and you never think something's going to happen to you until it does happen to you, and it is happening. It's happening to kids in high schools in the KC Metro, and so be safe, and if you see anything suspicious, notify your school, teachers, your nurse, your parents, or law enforcement. Thanks for having us, and Dallas, do we have any questions?
I do not see any questions that have shown up as far as our live audience, but we will continue to monitor that and then probably follow up with you two gentlemen if any questions would come in, along with Kathy's help as well. Kathy, would you like to add something?
Well, I'd be interested, Investigator Wilson, if you have any accounts to share and things that you're seeing firsthand, or just things that you might be able to address and talk about a little bit.
So I think the big thing, especially with the fentanyl, the perk 30s in particular, is you might smoke them all the time. but you're going to get one that has more fentanyl in it than the rest of them did, and that's what's going to put you down. I've tested a bunch of them where they're hard to find the fentanyl in, and then you test the next one and it has so much more than the rest. There's no way they cut it. I mean, it's just what's in that pill is what's in that pill. It might kill you. It might make you high. They're just, I can't express how dangerous they are. A lot of the case, like you said, we started working this because of high school girls. They got put down by fentanyl pills, and then it was weird. That's not normal for us. Generally, we worked with meth users, heroin users, people that have been doing this their entire lives, with career criminals. And now it's affecting normal, everyday people. I'd go in and I worked undercover for a long time. I would go in and buy these things. And I was able to do it because it's not like a normal meth user. Everybody of all walks of life would buy these things, and that's who would be affected by it. It's normal families, it's normal people. That's just the way that it's working with us for some reason. It's pretty crazy.
I'm going to have Kathy join these two gentlemen on the set because I think a couple of these questions that just came in, Kathy, you may want to answer. One from Kristen. Kathy, how is our district preparing for a possible overdose? And then Gina asked a question that really goes along with that, and that is, does the district have Narcan in all of our schools? So, Kathy, like I say, you would probably be apt to answer those questions.
Those are great questions. Thank you, Dallas. Well, preparing for this, we want to get the word out, first of all. So we want to get the word out to our students and to our staff. And so we have this is one of the examples of ways that we are preparing because we want prevention is really, where it's at, the key. We don't want kids to take a pill. And we don't want them to take that chance. And so we have Sergeant Farmeyer was talking about that he presented to health classes, and he did that at Liberty North and also Liberty High School. It's being interjected in our curriculum, and so we are wanting to get the word out that way. We have some public service announcements, things like that, videos that we're going to want to get out, and just more education. So the more awareness we can raise, the better. The other way, we have strong community partnerships. So we're working with drug task forces in our community and in our county to be able to provide resources to us. In addition to Narcan, which is the reversal drug for an overdose. So we do have currently Narcan in every building in our district, not just every school, every building in our district, because we want to protect all those patrons or staff or students that happen to come in and out of our buildings. But the thing that just we can't be too cautious about or think that just because we have Narcan, that doesn't mean that's a panacea. That's not a cure-all. And if a student or somebody thinks, oh, I just do this and we have Narcan, well, that it may not be enough. So sometimes these doses are so high, and some of the newer fentanyl type of drugs that are coming on the scene are way too strong and way too potent that just a couple doses of Narcan is not going to bring someone back. And so we're prepared for overdose, but no one can be prepared to reverse some of these stronger, more toxic drugs that are coming out. And then there are some coming on the scene that Sergeant Farmeyer didn't discuss yet, but that Narcan is not a reversal for. So there are drugs that they are mixing in also that Narcan doesn't help. And so anyway, we're just wanting to get the word out, but obviously prevention is the key. We don't want anybody to take a pill from a friend, even your closest friend. You can't do it. You just can't take that chance. We want you to succeed in life, and we want our students to succeed, and our staff and our community family. And so just don't do it. There's other things, there's other ways to help our counselors, other resources to be able to get for those mental health issues and just crises that we all have, and we all want to feel better, but this is not the way to do it. So.
Yeah.
As you all have been talking, we've received a few more questions. a lot around Narcan. I think this question from Megan would be directed to our two friends from the Clay County Drug Task Force. And that question is, would you recommend regular citizens have Narcan on them if they feel comfortable, or is it just for medical professionals?
No, I highly recommend even your average citizen having Narcan available. One, it's almost getting to where you need to know how to do that as well as CPR now, because you don't know where you're going to be in a situation where someone could be having an opioid overdose. And it doesn't take any real training to be able to administer Narcan. All you have to do is just put it up their nose and push, and to bring someone out of that opioid overdose, and then along with calling 911. So, yeah, I would highly recommend for citizens to have that with them as well.
And then connected to that, a question from Jennifer: how does someone go about getting Narcan to have at home or to carry with them?
Well, I know you can get it from pharmacies. You can get it from there. I don't remember what they charge. You might have.
Yeah, so it's my understanding, and we've tried this, one of our colleagues have tried this. You can walk into a pharmacy and ask for a box of Narcan, and there's no charge. When it was tried, that was given to them, no charge, and I don't believe it's processed through insurance. I'm not sure about the details, but I do know it's available at pharmacies. I also know that upcoming in the future, there's a lot of funding that's going to be coming down so that we will have it more readily available through some of our county efforts as well. But just stay tuned with that. But pharmacies are the number one place. You just walk in, and it's my understanding that you just ask for it, and you can just have it there.
Good question here coming in from Gina. What happens if I give Narcan when it's not an actual overdose? Will it hurt the person?
That's a very good question. It will not. It is the great thing about Narcan is if it's administered to someone and you think maybe they are having an opioid overdose, but they're not, it is not going to hurt them. We will take Narcan as a preventative if we're going into a situation where we have to recover like powder fentanyl from a scene or something like that. We will take Narcan ourselves before we go in, just to help protect ourselves.
Here's a question from Shim. First of all, thanks for the info. And then, have you encountered fentanyl laced in marijuana?
We have encountered fentanyl laced in marijuana. It is hard now to buy anything off the streets without it being laced with fentanyl, and that includes marijuana. A lot of people ask, well, why is that? Why would they want to do that? Well, basically, it all comes down to money. The best way to get someone to come back for more is to get them addicted to it. Fentanyl is so highly addictive; you could be addicted to it just after using it one time. So they will inject it with everything, different narcotics, so that way they can get them to come back to buy more.
Another good question coming in from Jessica. How do we effectively communicate this to our teens at home?
Biggest thing, like what we do at our house with my wife, with our two older kids, is we talk to them. We communicate with them. I tell them, I come home from work and I'll tell them what I had that day, what I saw, who I talked to. Even if I was talking to the health classes here at Liberty when I did it that day, I told them that I talked to. And they understand this. We check their phones. We check their social media. We have their passwords, and we routinely check to see who's on their friends list and who they're communicating with, and they're okay with it because they know that ultimately what we are trying to do is to protect them.
Very good. I am not seeing any more questions, but as we expected, really good questions coming in and great engagement from our community. And as I mentioned before we jumped into the Q&A, that feel free for those that are watching this maybe in archive format following this live event, plug those questions in and we'll be sure to to get an answer. So with that, Kathy, I may have you go ahead and wrap it up. And from all of us at Liberty Public Schools, we'd like to thank you two gentlemen for joining us this month.
Thank you. Thank you for having us.
Yeah, thank you so much. We can't thank you enough for your partnership and being in the trenches and the sad things you see and the work that you continue to do despite just the heartache that you see and the things you deal with, because that's where it's real. And honestly, to all of us out there that are watching and tuning in and to our community, this is a community-wide effort. This is all of our responsibility. This is a community thing, and if we want to save our youth and our folks from every walk of life in our community, see something, say something, encourage others just to go seek help, the right kind of help. And so let's just all take this responsibility as a community, because we want to keep our community healthy, and let's get in the trenches with these guys and do what we can and do our part too. Thank you for tuning in.